Hi, my name is Jennifer Fenwick, and I'm the Director of Project Management for the Americas region at Markin. And I wanted to take a few minutes to run down some pointers, I think, about our direct-to-patient services that I think will be especially helpful for those of you that are actually on the ground delivering these boxes of medication and supplies to patients. Really, one of the main focuses of direct-to-patient is to be a service that is convenient for these patients that are participating in these clinical trials. Direct-to-patient has been around for several years, but it's really expanded quite significantly over the last few months, especially as COVID-19 has spread around the world. And many of our clients have been looking for the immediate option to be able to supply the patients with the medication that they need for the clinical trial to prevent them from needing to travel into clinical sites or hospitals where they might risk becoming coming into contact with COVID-19. So really that convenience factor is the main draw, not only for the pharmaceutical company that's running the trial, but also for the patients. I think, we've all gotten accustomed to a certain degree, and even more so again in recent months, to having things come to our homes so that we're not out unnecessarily and interacting with people, especially if we have family members that might be at high risk along those lines. So in many cases, these patients might be at high risk. They might be receiving treatment for a certain disease or indication. But really, that medication or that illness that they're suffering from might also bring other consequences along with it, which could make them potentially high risk for contracting COVID. But despite COVID and despite those more recent circumstances, it truly is a convenience factor. In many cases in clinical trials previously, patients were always going into a hospital or a clinical site to receive their medication. And in some cases, patients might live 50 plus miles away from the nearest clinical site that's participating in that trial. So it became quite a burden for them to travel all the time to that clinical site every week, every other week, depending on what the dosing schedule was. So really it's become a convenience factor for them and will really engage patients to want to continue in clinical trials. So with all that said, I think some of the most important points to keep in mind when it comes to delivering a direct-to-patient shipment for Markin, first and foremost, and I'm sure this has been said multiple times, is being on time. It's not always necessarily just one person that you'd be meeting at the home in order to deliver the shipment, but it could potentially be the patient as well as a nurse or home health care provider who might be there to do the medication infusion or to take a blood draw afterwards, or any type of service along those lines that kind of takes the place of a clinic visit. So in many cases, there are multiple people that we're trying to coordinate to be at that home at that specific time. So there's a lot riding on the fact that we can be on time and show up when we've said that we would. I think another really important thing to keep in mind is that these are patients that are participating in clinical trials. So it's important to maintain sensitivity when communicating with them. Maybe you've knocked on the door and they didn't answer immediately. Maybe they're hard of mobility, and so they're not able to get to the door as quickly as someone that could normally do so. So I think there are a lot of factors that go into direct-to-patient, and just kind of knowing and respecting that they might have particular challenges just because they are participating in a clinical trial. And then maybe finally, I think clearly there's a lot of direct-to-patient projects that we are running at Markin. Each of our clients might have specific requests or a specific type of procedure that they want done at the delivery point. There could be a variety of different packaging types that you're handling, temperature monitors that you're handling, and sometimes it's definitely difficult to keep track of all those instructions, which we are certainly respectful of. But I think probably in those scenarios, the most important thing to remember is that in case of any doubt during that process, if you're not sure what the instructions are for this protocol, if you don't know if you're supposed to get a signature or not, call the Markin office. Our Markin logistics branches that have requested these dispatches, they are in close contact with a project management team. And that's where we keep all of those individual instructions for those protocols, so that in case of any doubt, you'd be able to reach out to someone at Markin who can provide clear instructions on what the next steps are for that particular delivery. So don't take a guess. Please reach out to us, and we're more than happy to ensure that it's done properly and as we've agreed with our clients. So yeah, I think that would probably cover it. The most important points for direct to patient. Appreciate all that you're doing for us and ensuring that these patients are really getting the life-saving medication that they've signed up to participate in. So that's it. Thank you so much. Bye.